Tufts does give physicians a sense that they really care about them and their quality of life.
I chose this practice because it worked better for me personally in terms of my other responsibilities and care for my children and my family.
I chose primary care because the relationships to me are the most important thing about medicine. When I was in residency, I thought, I don't want to be somebody's cardiologist or their gastroenterologist. I want to be their doctor.
I think the physicians that have found Tufts to be an exciting place for them are folks who maybe have a little bit of entrepreneurial spirit themselves.
Our specialists at Boston rotate through our community practice. You can be a teacher, you can do inpatient medicine as well as outpatient medicine. You can be involved in quality projects. As a teaching hospital, again, we're looking at what's the forefront, what are the things that we want to make sure everybody's learning to continue moving primary care forward.
At Tufts Primary Care in Quincy, the layout of the building has been focused around teams. My colleagues, as well as the other medical assistants, it facilitates our work. Our specialists who come to this practice, they sit in those team rooms with us, and that was by specific design so that we are interacting with them on a day-to-day basis and that we get to collaborate.
We all know each other, we know each other well, and the physicians work together as a team. And no matter who you talk to, it's always about the patients. We are part of NEQA, which is our extended physician network. We're 1,800 physicians. We also are really trying to figure out how to do the best possible job of population-based care, both here and in our community practices at both Framingham and Quincy, so that we really are taking care of patients even when they're not sitting right in front of us.
For me, it was really important to practice in the community in which I live. I live on the South Shore, and I am able to see patients who are also community members of mine. It's really important to me.
One of the big charges of Tufts Medical Center is to be teaching, and so we take that mission very seriously.
We have residents who come out to our practice, and I'm responsible for kind of directing their education. It was really important that I still be tied in with an academic medical center that had a good reputation. We have physicians who, for some of their patients, they have been the primary care doctor for 25 to 30 years, and that's a very different model than with which I trained. For me, that's actually a really special type of mentorship to be able to see that.
As the division chief, there is nothing more important that I do for our patients and for my colleagues than bring in more wonderful people to work side by side with them.
I now feel like I'm kind of in a sweet spot where I really enjoy coming to work each day. Part of it is the building and part of it is my relationship with Tufts, but the biggest part of it is the relationship with the patients. And we'd really like to have physicians here who want to develop that sort of relationship with their patients over time, because I really think that adds to satisfaction and quality of care.
Our vision largely is to try to really move with primary care as it grows and changes across the market in Boston. And we feel like our charge is to provide the best possible care to our patients as healthcare continues to change.